Beta-adrenergic blockers, commonly known as beta blockers, are a major class of drugs that act by blocking beta-adrenergic receptors in the heart, blood vessels, and other tissues, thereby reducing the effects of catecholamines such as adrenaline and noradrenaline. They are primarily used to decrease heart rate, myocardial contractility, and blood pressure, making them extremely valuable in the management of hypertension, angina pectoris, arrhythmias, heart failure, and post-myocardial infarction. Based on their receptor selectivity, they are broadly divided into non-selective beta blockers, which block both beta-1 and beta-2 receptors, and cardioselective beta blockers, which selectively block beta-1 receptors only. The non-selective beta blockers act on both beta-1 receptors in the heart and beta-2 receptors in the lungs, blood vessels, and uterus, hence, they affect both cardiac and bronchial functions. These drugs reduce heart rate and contractility but may also cause bronchoconstriction, so they should be avoided in patients with asthma or chronic obstructive pulmonary disease, COPD. Non-selective beta blockers are further divided into those without intrinsic sympathomimetic activity, ISA, and those with intrinsic sympathomimetic activity. Without ISA means the drug acts as a pure beta receptor antagonist, producing complete blockade without any intrinsic stimulation, whereas with ISA means the drug acts as a partial agonist, providing mild stimulation of beta receptors while still blocking the effects of catecholamines, thereby causing less bradycardia and fatigue. Non-selective beta blockers without ISA activity can be remembered with the mnemonic to avoid post-traumatic stress, PTS. A day before the exam is the PRO time to study, where PRO stands for propranolol, time for timolol, and S for sotalol. These drugs are commonly used in hypertension, arrhythmia, migraine prophylaxis, and performance anxiety, as they help stop stress. Among non-selective agents possessing intrinsic sympathomimetic activity, ISA, the key drug is pindolol, which acts as a partial agonist and produces less bradycardia and fatigue. This can be remembered with the mnemonic PIN has partial power, where PIN stands for pindolol, indicating that it has partial agonistic activity. Some non-selective beta blockers such as lebetalol and carvedilol also possess alpha-blocking activity, producing vasodilation beneficial in hypertension and congestive heart failure, CHF. They are easily remembered with the mnemonic LabCar is a dual-action vehicle, which indicates that these drugs block both alpha and beta receptors. In contrast, cardioselective beta-1 blockers predominantly act on beta-1 receptors in the heart, reducing heart rate, contractility, and myocardial oxygen demand without significantly affecting beta-2 receptors in the lungs or blood vessels. This selectivity makes them safer for patients with asthma, COPD, and diabetes. The drugs in this group can be easily recalled with the mnemonic most accurate beta blockers is blood circulation naturally, which includes metoprolol, atenolol, bisoprolol, betaxolol, esmolol, celiprolol, and nebivolol. These agents are the preferred drugs for managing hypertension, ischemic heart disease, arrhythmias, and heart failure. Some have unique features. Esmolol is ultra-short-acting and used intravenously in acute arrhythmias. Nebivolol promotes nitric oxide release, leading to vasodilation, and celiprolol provides mild beta-2 stimulation, making it particularly suitable for asthmatic patients. In summary, beta blockers are cardioprotective agents that improve cardiac efficiency by reducing the heart's workload and oxygen consumption. Their classification, effects, and uses can be easily remembered through mnemonics. PRO time to study. For non-selective agents without ISA activity, PIN has partial power. For those with ISA activity, LabCar. For alpha plus beta dual blockers, and most accurate beta blockers is blood circulation naturally. For cardioselective beta-1 blockers. These simple associations make understanding beta blockers easier, linking their pharmacological properties directly to their clinical applications.